Thanks again, Jay. And you know, I think there's definitely something to the adage that laughter is the best medicine. And that's why we're, partially why we're here today, because we do want to be remembered that without our health, we can't be the people we want to be. And I don't know about you, but I want to be a guy that laughs a lot. And sometimes the pain of arthritis or whatever else might be in front of me that day could get in the way of that. And so without all of our, without our collaboration, without working together to achieve the results we want, we're not going to have a chance to laugh. So now, with your permission, I just wanted to share with you a couple of remarks here that we prepared. We too actually visited folks in Washington this morning and last night and made it here just in the nick of time. But we had a chance from Washington to New York. We took the long way by car. So we had a chance to talk and think about some of the things we wanted to share with you today. And so with your permission, I do want to share this as well. We want to, of course, on behalf of all of us at the Global Healthy Living Foundation and the folks that work very hard every day, our Executive Director, Lou Tharp, Marco, Alexi, Nam, Jared, the team, Joey, and on. We're passionate about this, and all of us want to welcome you to the second anniversary of the Affordable Care Act, or maybe the last anniversary. See, when many of us met in this very same room on October 1st, 2009, the eve of the vote of the Affordable Care Act, when we honored Dr. Pamela Rosenthal from Bellevue Hospital as our Doctor of the Year, we spoke about whether this bill would even pass. None of us at the time thought that even if it did, the Supreme Court would have the last word, contravening the will of Congress and expanding the definition of activist judiciary. Our new compilation of speeches, Speaking Out, which we're giving out for the first time today, literally, we got these from the printer this morning, has the complete text of that 2009 presentation. But I'd like to quote from it because, courtesy of the Supreme Court, we are once again back on the eve of achieving what every other industrialized nation in the world considers a right: healthcare. Remember back to 2009, October. We were still in the economic dumper. The Dow closed that day at 9,509, down 210 points. Today, it closed at over 13,000, and I meant to check this. Does anyone know what the Dow closed at?
Not all of us own stock.
Me neither. But I guess my iPhone could tell us. Either way, over 13,000. The unemployment rate back then was 10.2%, the highest it had been in 26 years, and today it is at 8.2%. Life was not good for many people back in 2009, and it's still not good for many, but life is getting better. It's getting better even if you define getting better as the natural result of being sick. In 2009, young people could not stay on their parents' health insurance policies. People with pre-existing conditions could not get them covered. There were lifetime payout caps on catastrophic situations, diseases that no one asked for. There were somewhere between 30 and 47 million Americans who were uninsured, depending on whose number you go by. Women were paying more for health care than men. And that has all changed today thanks to the Affordable Care Act. So that famous Ronald Reagan slogan, "Are you better off today than you were 4 years ago?" is definitely one that can be answered yes, if today we're talking about health care. Or, if you want to borrow a phrase from someone a little closer to home, our revered Mayor Ed Koch, how am I doing? The answer when it comes to health care and what President Obama's work has demonstrated, and all of that with the Department of Health and Human Services, you're doing well. It's not comforting to know that America is the only industrialized nation that doesn't consider health care a right. It's not comforting to know that we have the highest infant mortality rate among our peer countries, or that our life expectancy is lower, or that those who can afford health care pay twice as much for roughly half the medical outcomes as our peer nations. It's not comforting that health insurance companies have placed themselves and their profits and high administrative costs between us and our physicians, effectively practicing medicine without a license. When they dictate which drugs our physicians can prescribe, which procedures they may perform, and rationing healthcare to us by charging deductibles and copays that often prevent those most in need from what they need most. Medicines and therapy that can allow them to lead a productive, a healthy, and a happy life. We're on the eve of saying no to all of this, but we can also let the status quo prevail. We can let the premiums keep going down. Up. We can let premiums keep going up as they were back then, let medical malpractice insurance continue to spiral out of control, and let another 17,000 Americans lose their health insurance tomorrow and every day after. 17,000 people a day were losing their health insurance because either they or their employers could no longer afford it, or because an insurance company decides that they're no longer a profitable, low-risk customer, and so they get dropped like freshman physics class. I dropped it quickly. See, it's comforting to know that what I said more than 2 years ago still feels right today. Time has not eroded the credibility of our words and the resulting Patient Protection and Affordable Care Act. And by 2014, we'll begin to resolve nearly all of those damning facts that made the United States a healthcare embarrassment in front of the rest of the civilized world. We talked about this too in 2009, when I said that because of what I do, I get to talk to a lot of people in government and with other advocacy organizations in other countries. And every country has its problems with healthcare. But when people outside the U.S. talk about the changes they want to make, one thought is crystal clear. They all agree that they don't want anything like our system here in the U.S. They couldn't imagine, for example, citizens of their country going bankrupt to pay for health care. But in the U.S., it's all too common. In 2007, 62% of bankruptcies in the United States, more than 500,000 people, were linked to medical expenses. Even more remarkable, 80% of those filing for bankruptcy had insurance. This is more than unfortunate. It's embarrassing, it's cruel, and it's completely unnecessary. We look at established and valued social programs such as Medicare and Social Security and Medicaid and Head Start, and we can't imagine a United States without them. But when they were being debated, special interests devoted to sustaining the status quo that served them well fought hard to prevent these valuable programs from becoming the laws we know and love today. Today, that same dance is occurring. Senators like Max Baucus, who has accepted nearly $3 million from the health insurance lobby, are trying to deny us the right to health care. It's more than unfortunate. It's embarrassing. It's cruel. And it's totally unnecessary. So now come back to the present for a moment. The unarguably conservative Supreme Court, more conservative than any court in at least 3 generations, hold our health in its docket. We think of the Patient Protection and Affordable Care Act as one that will survive. We'd like to think that the justices, after historically misguided decisions such as Citizens United and Bush v. Gore, they'll think about their legacy, and that'll become part of theirs if they create a terrible trifecta by throwing 30 million people out of their healthcare system on the precarious legal grounds that require, among other activist endeavors, reinterpreting the Commerce Clause. We think, and our thoughts may very well just be wishes, that the Patient Protection and Affordable Care Act will survive. We even believe the decision will be 7-2, with Thomas and Scalia refusing to recognize that healthcare is the responsibility of government and the right of the people. But what do we know? Well, we don't know how the justices will ultimately decide. But we do know all about Brenda Klein Sasser in Bismarck, North Dakota, and Louise in Los Angeles, California, and the many other people who have filmed videos about and then posted it on their YouTube channel telling us their story about how the Affordable Care Act has affected them, their Affordable Care Fact. And these are telling stories that should never have been told, except that America forgot its responsibility to the sick, preferring instead to listen to the desires of the wealthy and the healthy. And for this short period of time, when pre-existing conditions were not cause for health care insurance refusal, when children could stay on their parents' policies, and when insurance exchanges are currently being set up across the country, with 80 cents of every dollar being spent on health care, by law, 80 cents, we may be able to reduce the cost of health care insurance. 80 cents on the dollar for health care. Think about that. Sounds great, doesn't it? Health insurance companies have traditionally spent between 50 and 75 cents on health care. So this, to us, is a huge improvement. Until you realize that Medicare spends 98 cents of every dollar on health care, not to administrative expenses or to salaries or to profits. But we know the Affordable Care Act is the best compromise Congress could reach, and we're happy to move forward with it, even if it's not as efficient as Medicare today. And this is why we're here celebrating tonight. And there are a lot of reasons to be cynical, to be negative, and despondent. But Americans, as Winston Churchill used to say, can always be counted on to do the right thing after they have exhausted all other options. We prefer to believe that we're in the process of exhausting all other options before we prove Churchill's hypothesis, and that is better than trying nothing and ultimately evolving into the antithesis. Unfortunately, we all have to wait this process out and see how it will play out. It's like waiting for Microsoft to sell software that actually contributes to productive work instead of high blood pressure. But the difference is we are not likely to die or go bankrupt from a bad Microsoft product. So in 20 years, our kids and grandkids will laugh at the crude software we used and deride Microsoft for it, but they can smile at the secure safety net that guarantees health care for all, but not understand how we could have debated the possibility in the first place of not having it. And the legacy of our Supreme Court will be marred, but intact. We can live with that. We can live because of that. So on behalf of all of us at the Global Healthy Living Foundation, we'd like to thank you very much for the opportunity to bring everyone together and to commemorate the work that you all are doing. And please tell our friends in Washington, keep up the good work, because we're working hard here in New York and around the country to ensure that we can all live a little bit healthier. So the last word I'd like to share for my time is up is to ensure that everyone gets a copy of our Speaking Out book. And also, while I'm up here at the podium, take the chance to acknowledge the writer and our fearless leader and executive director, Lou Tharp, who's here. Lou, by the way, who was just recently appointed by the Secretary of Defense through the Obama administration to serve on the Army Education Committee, and we're proud of that. And it just means we're run like a militant organization. Military organization, excuse me. That would be my mom next to you in my household. So that's the difference. And of course, my mom. I do want to say hi to my mom because she's here. And actually, all of this is for her. So on behalf of all of us at the Global Healthy Living Foundation, thank you, enjoy, eat, drink, be merry, and we'll see you again real soon. There's much work to be done. Thank you.